So when you think about the patient journey, all across start to finish, you've got different stages. You've got new inquiries. You've got interested and engaged leads. You've got initial consultations, post-consultation, preoperative, postoperative, etc. Across the journey, you have to follow up a lot. If you think about B2B sales, one of the guiding principles of B2B sales is follow up. Follow up more than you think you have to. You reach out to a prospect, they come back to you with an answer. You need to follow up 4 times, 5 times, 6 times. Then you circle back 3 months later if they don't answer. Check in on them again. The same principles apply here. You have to follow up consistently in a very high touch manner, in a way that does not feel salesy, but feels supportive and feels confident in helping the patient along their journey. So when we think about follow-up, what we're talking about is nurturing that patient at every single stage of the journey, even if they're on track. They may have that next appointment, but they still need support. They still need follow-up. How are you feeling? We saw you on Monday. Now it's Wednesday. That's following up. So this idea of follow-up is something that goes top to bottom across the patient journey. The difference with patient recall is that recall is specifically an activity that is intending to bring the patient back into the clinic. Following up can be clinical, can be non-clinical, can be administrative, can be supportive, can be revenue-centric, but patient recall is a subset of follow-up. It's an activity that is specifically dedicated to bringing patients back into the top of the funnel. So patient recall is, I had an appointment X months ago, and I don't have a next appointment. That particular part of the journey is where we focus on patient recall. And the thing that's interesting about patient recall is that, number one, no one. Number two, when they do it, they think that it's good enough to make a single phone call, a single email, a single touch point. We hear this all the time from practices. We ask, do you do patient recall? Talk to us about what your patient recall looks like. And they'll say, yeah, we do it. It works really well. We make one phone call, we send one email. And so now you have a reality where you think you're doing this thing, but it's ineffective. And so you say, yeah, a single phone call is good enough. Single email is good enough. Of course, that's not the case. Both of those are difficult channels. Let's say you call, nobody answers. Your email gets lost in a long list of things the patient doesn't have any time for. And so this idea of patient recall is about making sure that as patients come to the end of the journey, they're having that support to come back. And we see the most amazing things when we start working with practices in patient recall. We see them reconnecting with patients who haven't been in some cases, for 11 years. We have a patient who came back to a practice in 2025 from the year 2012. That's 13 years. That patient didn't move away. They weren't inactive. They didn't stop caring about their clinical need. They just arrived at a point where they said, actually, a little bit of nurture reactivates that decision, because there's a connection between provider and patient, and that connection needs to be nurtured, needs to be maintained, needs to be supported. And that support does not come in the way of a random phone call and a random email. It comes in the way of direct personal engagement between practice and patient in a way that looks and feels familiar, not clinical. So we were with an MSK integrated health group today. 9 sites growing to 10, very cool outfit, very professional, very modern, very forward-thinking, very innovative. And we were talking about what are the key business priorities right now? What is the important stuff for you as a leadership team? What matters? What is the strategy from going where you are to the next stage? And the 2 things that came out were, number 1, focusing on any point of the clinic operation where there's a lot of manual work. And number 2, creating capacity for your clinicians, creating capacity for your practitioners. And that's a really interesting observation, because a lot of times the jobs that you need to do in the clinic fall either on the front office administrative team or on the clinician. And the assumption that just because those things are getting done, A, does not mean that they're getting done well, and B, it creates different downstream risks. So a very simple example is, let's say that you have a huge body of clinicians. They're doing a lot of administrative work that they're not happy about. That reduces work-life satisfaction. That reduces joy in the workplace, and as a result may cause an increase in potential churn. That's the last thing you want to do for your clinicians, who you do such a long job of trying to recruit them, retain them. The last thing you want to do is have them walk out the door. And so when we think about those priorities, removing manual work, focusing on specific points of operational delivery that are underattended, but also creating that capacity to really focus on patient care and remove the burden of doing things like patient follow-up, doing things like patient recall, and instead creating that sort of work harmony for the practitioner where they can show up, see patients, and then leave at the end of the day. So we're speaking to a very large hospital network. They've got presence in the UK and in the US. And we were talking about the different operational work that needs to happen in the organization. And what was described is this process of receiving an email, copying and pasting something out of the email into a spreadsheet, sending the spreadsheet to someone else. That person receives the information in the spreadsheet, pops it into a form. That form then gets sent along to someone else, and then an email is sent at the end of the stage to the billing department. The billing department then gets back in touch with the patient. So from a process perspective, you've got 6 departments all touching a different part of the journey. And the reality is that when you're in a healthcare provider setting, that is all over the show. It's everywhere. Every time something happens, you have these learned processes. Sometimes they're documented, sometimes they're not documented. And all of this work happens around these processes that you don't really think of. It's what kills your time. So in a smaller provider operation, it might be that all of the to-dos are locked up inside of WhatsApp chats. In a larger organization, it's all locked up in email threads. But the reality is that is the busy work of the organization. The busy work of the organization is not dealing with the patients. The busy work of the organization is this cloud of stuff that happens as a result of serving the patient. And that's what you need to compress. So when you think of someone like this person we were speaking to, whose job it is to go around and try to lean out those processes, what you very quickly come to discover is that you have these holes. This thing that you have to copy paste only gets copy pasted 70% of the time, and 30% of the time it gets dropped. And actually that 30% of the time, you might be losing patients because now they're not hearing from you for an extra 3 months, for an extra 4 months. So, okay, great. I'll just go down the road to someone who provides a almost as good service, but at least I know I'm going to hear back from them. And the thing that we love about these conversations is that the premium providers, the top-line healthcare providers know more and more that the clinical quality is table stakes. Important, but table stakes. It's binary. You either have it or you don't. But a lot of people do. A lot of providers do have really high-quality healthcare provision. There are a lot of great restaurants that serve sushi. The thing that makes your restaurant that serves sushi different is that when people walk in, they have an experience, they feel supported, they get nurtured, they have that relationship with the provider that transcends the clinical care. That is the thing that changes the game. And what was really interesting in speaking to this organization is that they said they've seen 10 years of extraordinary growth in the private healthcare provision space in the UK and in the US. It has been explosive, but they're now starting to realize that there's a bit of an asymptote. It's starting to peel off. And they're saying, okay, this is no longer about rapid inflow of new patients. It's now about getting more from what's there. We've built this nest egg of hundreds of thousands of patients. How do we support them? How do we move them from journey A to journey B and journey B to journey C? How do we make sure they complete journey C? All of that interaction that happens throughout service is a failure mode for the healthcare provider. And it's ultimately the exact layer that follow-up, which feels very administrative, but is actually deeply strategic, seeks to solve. Yeah, so in the US, you don't have a WhatsApp dominant culture in the same way that you do in the UK. You do have message-based, text message-based interaction, which is much more prominent. In the UK, obviously, it's more WhatsApp-led. The thing that's really interesting about voice in healthcare, and one of the things that will be really interesting to see in the next few years with respect to all the voice AI agents, is that people have this assumption that healthcare is a voice-native sector. It's a voice-native interaction because people have 30, 40, 50, 60, 70 years of experience of whatever number of years calling doctors' practices. This is an entrenched and learned behavior. And what's really interesting about that is the innovation of voice AI assumes that mode of interaction should continue. But now we've made it better because we've layered in AI so you can have that voice conversation faster. And in some ways that's true because it's easier to dialogue than it is to type. It's undoubtedly easy to provide that dialogue than it is to type. But there's a very big difference between voice and message, and that difference is synchronous or asynchronous. Voice assumes that a patient is able to connect at a moment in time and to dedicate the appropriate attention and resource to solving a specific set of, for example, intake questions or billing questions. Whereas if you move into an asynchronous channel that is easy to access, You provide more convenience to the patient because they can handle that in their own time. It's really a similar transformation to, do I want to book online or do I want to call to book? If I book online, I do it on my time. If you make me call to book, I do it on your time. And so granted, AI and voice AI makes it easy to call on my schedule, but we are increasingly seeing a generation that does not want synchronous interaction. Older generations, understandably, they may be more accustomed to that learned behavior. Younger generations of patients are looking for asynchronous interaction that they can pick up when they want. So it's an interesting challenge. Where does voice come into this follow-up layer? And I don't think anyone's really cracked it, but I think what we can feel confident in saying is that assuming that the transformation for the front office is people don't have to speak to each other on the phone, the first principal assumption there is that people still want to make phone calls. And we're not entirely convinced that's the case. Some people might, but oftentimes people want asynchronous modalities of communication because it's easier for them. It means that they can do it on their time, when they want and when they're ready to engage, as opposed to being pushed to have that conversation at a certain point in time. I think what we're seeing in the communication that we have with patients is that if given the option, people are very comfortable to bias to asynchronous messaging. If called, some are happy to take that call. Many people will feel that's an imposition. But if given the opportunity to engage asynchronously, that is typically a preferred channel. Now, some of those people may write back and say, do you mind giving me a call? But in that interaction, they're opting in. They're making a decision to say, I'm actually ready to hear from you, which is especially important in recall. And it's especially important in follow-up because unlike a new patient inquiry that comes through the top of the funnel, who are basically saying, hey, get in touch with me and help me, oftentimes in follow-up and in patient recall, you're pushy. And I think that's one of the reasons why a lot of healthcare providers are afraid of doing recall. They're afraid of doing follow-up because they feel like it's going to push patients into a relationship and an engagement style that feels like they're being nudged or unfavorably pushed in a certain direction. But doing that asynchronously in a soft, personal way doesn't feel as pushy. It feels like a friend is writing to you. It feels like a family member is writing to you, and it makes that much more convenient. And that is one of the key differentiators, I think, where we were to where we are today. We have a patient at a dental practice that we work with who wrote back into a message saying, dear patient coordinator, thank you so much for the message. It warms my heart that you would follow up with me. And you're a dentist, you got in to fix you didn't get in to warm people's hearts. And the reality is that when you show that support and you extend that support, that person is a champion. You just turned a patient into a champion. That champion is going to go out to dinner with their friends. They're going to talk about your dental practice. They're going to go to their family holiday. They're going to talk about that dental practice. They're going to talk about the incredible communication, the ease of booking, the ease of interaction. And that's how you grow. That's how you grow within a local community as a healthcare provider without spending more and more on ads. You grow when your patients become champions and they start advocating for the quality of the service. And that is a really important lever for practices and providers to unlock growth in the next year or two. The patient journey is a bowl of spaghetti. It's not a straight line. So to assume that a patient is able to navigate complex care pathways with printouts, handouts, PDFs with loads of information alongside their entire life, admin, journey, children, family is fundamentally wrong. So the number of times you see a patient go in for a consultation and walk out with a long letter all the time. And it's really interesting because this evolution of medical scribes, this explosion of medical scribes has saved the practitioner an incredible amount of time. It's a practitioner-centric solution. It says you don't have to write this up. So now you've got it automatically transcribed and you can send it out to the patient right away. And that's great because you've saved time and you've given the patient something that's accessible and now they can have it quickly instead of needing to wait. So those are wins, but you've made a really flawed assumption there. The assumption is that the patient can understand it. You've assumed that the patient walked out of that consultation with the information that they need to make a decision, but enabling the decision is totally different than giving them the information. And so if you think about a patient receiving a long note that explains a clinical circumstance, they need more. And we hear this from the providers that we work with. We hear this from the doctors that we work with. They often say, sometimes my patients don't feel comfortable to come back and ask me questions about the consultation when they're not in front of me because it's too hard. They don't have a way of accessing that responsiveness from the clinic. And we need to give them that ability. We need to make it easy for the patient to reach out and ask a question, not call, write, wait, hold, but simply to send a message and say, hey, I had a question about this thing. Can you help? And then we need to make it easy for the provider to communicate the value and the response quickly, easily, not through 3 layers of bureaucracy, but rather something that lights up to them and says, oh yeah, I saw that patient yesterday. I can ask that question and it's not a huge inconvenience for me. Because practitioners got into that job to serve patients, to provide care. We spoke with a wonderful surgeon based on Harley Street earlier this week, and he said, I want to know when my patients are unhappy. If you encounter an unhappy patient, tell me, bring them to me so that I can fix it. Because if they don't tell me, I will never. And the reality is that very few patients feel comfortable to go back to their provider and say, hey, I wasn't happy. They need a different modality of engagement. And if they don't get that proactive approach and they don't get that proactive support, they go away unhappy, they speak ill of the practice, they leave bad reviews, and in a worst case scenario, they show up with a lawsuit because the thing they paid for is not what you gave them. And that could have been addressed if you had been in touch 11 months earlier. That is a key problem in the patient-provider relationship that needs to be unpicked. So the idea of proactive and reactive are really interesting in a healthcare setting. So again, I'll use the example of AI agents in the healthcare front office. A huge job for the AI agent is to be reactive, but to be reactive faster than the front office. Somebody calls in, clinic reacts, AI reacts faster, no problem. Patient has an upcoming appointment, AI calls the patient to confirm. Again, reactive. There is an appointment. The appointment is the thing that triggers the action. The problem is that all of that reactive activity misses the proactive engagement of the patient because there's no way of seeing what needs to get done inside the appointment book. So we have this really interesting thing that happened recently where a healthcare provider saw and said, wow, they were really happy with their outcome. It seems like they are really excited about the work that we're doing with them. They're excited about the care. They're excited about the transformation. I think they would be a great person to leave a Google review and a testimonial. What do you do next? How do you take that knowledge? That's something that the practitioner observed, they felt in the room. It's not written down in a clinical note. It's something that they perceive in the relationship. How do you then lift that task? You extract that task, and then you make sure it gets delivered. The way that happens right now is a practitioner walks downstairs, hands the patient back over to the front office and says, oh, follow up with them to Google review. Maybe the front office actually does it. Maybe they send an email, thank you so much for seeing it. It was great can you leave a Google review? That is not delivering on the outcome. The outcome is reaching out to that patient, giving them that support, introducing the idea of leaving a review, and then following up with them proactively, not because they have an appointment or they don't have an appointment, but because there's an opportunity for the healthcare provider to enable its brand, to bring its patient's voice to the surface, to improve its Google reviews, to improve its testimonials. That is how you cut through. You don't cut through with paid ads as a healthcare provider. You cut through with trust, with evidence, with the patient voice. And enabling that patient voice is a really key part of our journey at Coherent. So I think as the healthcare provider gets larger, as they take on more complex clinical work, the difficulty of proactively managing your patient relationships does not increase linearly, it increases exponentially. So I'll give you an example. Let's say that you're a private hospital, you're providing MRIs, surgical interventions, orthopedic surgery, respiratory surgery. You're providing a clinical service that is very complicated. And so the nuance, the accuracy, the precision with which you need to deliver that clinical service goes through the roof. It is entirely different than going and receiving an injectable at an aesthetics clinic or a hygienic cleaning at the dentist. So as you get into more complex clinical care, the nuance in how you manage that follow-up becomes much harder. And so now you've got a finite capacity in your front office team, in your administrative team, that are managing these don't mess it up situations. There's a whole lot of don't mess inside of these larger organizations because one mishap creates enormous clinical risk, legal risk, downside for the organization. And a $100 million lawsuit is a huge problem by comparison to one more happy patient. And so you end up solving for risk. You end up focusing on getting things right as opposed to engaging and supporting the patient. So you've got an entire front office team that's focused on trying to move these components, these gears, these locks, these turns along the patient journey And it's too easy to lose sight of the person at the end of that journey. It's too easy to lose sight and to disconnect with that patient because they're not physically there. They're not currently going through that process. And so these larger healthcare organizations, incredible in delivery, phenomenal in clinic experience, absolutely horrific patient experience. And one of the collaborators at Coherent recently went to a large private hospital and said the care they received in the room, extraordinary. It felt like going to a 5-star hospital. You walk out of the room, the intake is slow, it's broken. The follow-up is slow, it's broken. The inconvenience of needing to go back and fill out forms again for a different service is slow, it's broken. But that enablement, that layer of enablement of relationship around the provider doesn't live in your practice management software, in your electronic medical record, in your hospital system. That's not what those engines are built for. Those engines are built for clinical compliance. They're built for operational efficiency. They are not built for delighting your patients. And if you want to win in 2026, in 2027, in 2028, you need to delight. You solve for delight. That is the thing that matters. If you're working in private healthcare, competition is just getting worse. If you were early to the rush in the UK and you were here 10, 15 years ago, 20 years ago, you were part of the evolution of the sector. In the US, you have this incredible competition. There are dental clinics on every corner. There are private providers on every corner. What makes you different? It won't be the clinical care. It's increasingly becoming a commodity, maybe not at the top level surgical procedure at the most invasive high clinical risk. Sure, there are a few specialist surgeons who might be able to provide that service. But as you start to move into more mainstream care, it is unfortunately increasingly a commodity service. So how do you get competitive in that market? How do you get competitive with the people down the block? If you're Starbucks, how do you compete against Dunkin' Donuts? How do you compete against Costa Coffee down the road? You need something different. And it's rarely the coffee. It's the ambiance, it's the experience of being there, it's the great communication, it's the ability to order in advance. This is about providing convenience to your patients. It's not about providing clinical service. And so you need leverage in building that competitive moat. You need to build defensibility around your practice. That defensibility is the relationships that you have with your patients. So a lot of practices that we speak to, they will say, and I'll give an example. We spoke with a provider who was interested in working with us for patient recall. And they said, you know what, we've got great internal processes. We're just going to try and overlay those to our recall process from other parts of the journey. And we said, great, best of luck. Let us know if we can help at all. Let's see how it goes. A couple months later, we got back in touch with them. Hey, how did it go? And the answer was, we haven't made much progress. That's not a criticism. The reality is that when you're serving patients and you're running provider operations, it is hard. It is time intensive. It is consuming. It is 7 to 7 or longer. You are constantly under the gun. So to think that you can simply lift up a process, stick it in that part of the patient journey and deliver it to a high standard is wrong. You need the right tech. You need the right team. You need to optimize. You need to go deeply into the content. What do you send people? What do you say? When do you say it? How do you send it? Those are all questions that need answering in order to deliver a good outcome to the practice and to the patient. And so one of the things that we often find when we speak with practices is they might say, I'll just hire someone to do it. The problem with just hiring someone to do it is that you have one person and 10, 20, 30,000 patients. That one person does not have the tools, does not have the know-how to manage the patient body at that scale. So what you're basically saying is, oh, I don't have enough people in my team right now, but if I just add one, that one person will suddenly be able to nurture, support, and engage tens of thousands of patients. There is no chance that will happen. That person needs power tools. That person needs amplification. That amplification is a technology problem. And that is exactly the technology that we're building at Coherent. We are building technology that amplifies the work of a patient coordinator or a patient navigator so that you can get one person to support the follow-up and the patient recall of 10,000, 20,000, 30,000 without needing to scale your headcount. Same payroll, more patients, totally different problem. So I'll talk about the old way. The old way was we're going to buy software. We're going to train our people how to use the software, and that's going to let us do something. And we hope that the thing that it does works. Simple example in patient recall. I'm going to go buy a follow-up app or a follow-up software. I'm going to write in the emails. I'm going to write in the messages. And now the follow-up is going to happen. That is a process. You're solving for a process. Now I can follow up with all my patients. But do they rebook? Do they engage? And if the answer is no, can you fix it? Probably not, because you have a static tool that's not optimizing learning. Oh, this patient responded on this channel. They like to talk in the afternoon on Thursdays. That patient responded on that channel. They like to speak at 11 a.m. on Mondays. Should we message them when it's sunny? Should we message them when it's rainy? That optimization is not a software problem. That is a data problem. And if you're a healthcare provider, the extent of what you can learn, the data is the extent of your patient population. Put that in a new context. Now what you're paying for is the data. You're paying for the intelligence. Who, how, when, what, where, done for you. You're paying for a specific solution, not to send things, but to receive them back in. And when we talk to providers, what we often say is, you're buying the engine. That is the solution. It's the engine. It's the people who know how to use the tools to engage your patient body, to increase revenue, to increase appointments, to increase patient satisfaction, to identify positive feedback, to identify negative feedback. The outcome is engagement from the patient body. The outcome is certainty that every patient, every time, is being followed up with. And there's a really interesting school of thought emerging around, is seat-based pricing dead? And there's actually a great company in the UK called Paid, run by a gentleman named Manny, and he often talks about the death of SaaS, the death of pay per seat, the death of give me a thing that lets me push the buttons to get an outcome. And the reality is that in this context, in healthcare, much like a lot of innovation, we are going to be late to the party. People are going to be buying seat-based software for the next 10 years while many other sectors have moved on. And so the question you need to ask yourself as a healthcare provider is, are you going to continue paying for process, or are you going to focus on paying for outcomes?